Hello, my name is Dr. Bushwereb. I'm a family doctor from UK. Today I'm going to present low back pain. I've chosen this subject because it's very common. A lot of people suffer from it. And for you who didn't come across my channel before, the reason I've created it just to explain about the common cases the family doctor will see on a daily basis, just to increase the awareness. Okay, so let's go straight to lower back pain. Okay, what are the symptoms? What are the causes? What's the questions which your doctor will ask you, and why he will ask you these questions, or she will ask you? As I said, what are the red flags, the treatment, investigations, okay, and examination. Let's start first with the questions which your doctor will ask you. And if you're having lower back pain, I'm going to ask you this question: when did the pain start? What were you doing when you had the pain? Have you been, for example, like lifting something heavy in the gym? Did you have an accident? Like, did you have a fall? And about the pain, did it come sudden or gradually? Again, when your doctor is asking this, he's trying to screen about like the problems which can come, for example, sudden. Like if somebody has like a sudden back pain and they had a history of an accident, then that goes more with the trauma, right? And if it came gradually, again, you're gonna think about it. Could be maybe musculoskeletal pain. It could be maybe even something serious. When did the pain start? Did you have the pain before in the past? Was it something chronic? Because a lot of people suffer from chronic lower back pain, or is it something acute? Are you taking any painkillers? For example, what are the type of the painkillers? Is it simple painkillers, or is it stronger painkillers? And what is the dose and how much? Do you have any family history of back pain? Because we know that back pain sometimes it can run into families. Some people, they have like early wear and tear of the spine. I mean, all of us like at a certain age, like let's say maybe like in 40s or 50s, we will have some sort of wear and tear of our joints and bones. But some families they suffer from this problem a bit earlier. And then your doctor needs to exclude red flags. So red flags are serious symptoms, okay, which can be associated with lower back pain. For example, non-intentional weight loss. So that means a weight loss without a diet. With lower back pain, cancer needs to be excluded. For example, if it was a man, a prostate cancer needs to be excluded. Your doctor will ask you about urinary symptoms. He will screen, do investigations, examine you, make sure there's no prostate cancer. If it was a woman, they have to exclude uterine cancer, ovarian cancer. Colon cancer needs to be excluded. I'm sorry, I cannot tell you about all of the questions about these cancers today, because it will be difficult covering it. But I've already covered it in other videos, so that's why it's important to subscribe and like the channel. And I will keep on repeating about like the red flags of cancer, so just keep tuned with me. Okay, so the question maybe you're wondering about, okay, why would somebody with a prostate cancer, why would they have like lower back pain? Because cancers, when they are internally, like prostate or uterine cancer or etc., or colon, the patient sometimes will not notice. He will not know that he has a cancer until it metastasizes, until it goes to the spine, and then he will present with weight loss and lower back pain. Okay. The second red flag is if there's any high temperature. There could be infection in the bones, like of the bones of the back, the spine itself. Or if somebody has, for example, urinary symptoms, pain when passing urine, anything with a high temperature, you think, well, with a low back pain, well, it could be a water infection, right? Or it could be maybe kidney infection. Does the pain improve when laying down? That's if the patient says, if somebody says yes, then with a history of maybe having a fall before, you start to think, well, it could be a fracture. And to be honest, from my experience, like it's usually people who are in older age. Usually they have like sometimes they have a fracture. And how do you know that? They tell you, well, it improves, my back pain improves when I lay down. Sometimes accidentally we do an X-ray and then we find, well, she had an old fracture, which she if it was like an old patient, maybe she had like a fall or anything, and not necessarily like for older people, not necessarily they had a trauma or a fall. Sometimes they just have a fracture in the spine because like they have like severe osteoarthritis, they have like a lot of wear and tear and very fragile bones, and they just have like a pressure fracture. So it can come with that. They will have lower back pain, and as I said, like it improves when they lay down, and then by an X-ray you can see it. Okay. Okay, red flags for cod equina. I don't know if you saw my videos before. I said like I'm not gonna mention any medical terms or anything, but so I'm sorry. I don't mean to frighten you by the name or the word cod equina itself. I'm just gonna explain it in a simple way now. So your doctor should ask you a few questions. I don't know if you went to your doctor before. Most likely, if you went there, if you saw your doctor because of lower back pain, you might notice these questions. And I'm going to tell you the reason why your doctor is asking you these questions. And if you didn't go to your doctor before, I'm going to explain to you, because these questions are very important with any patients with lower back pain. Did you ever lost or had any problems with sensation, feeling of your legs or around the back passage? You know, when you wipe the back passage. Did you ever had any weakness in your lower legs? Did you ever pass urine or feces without knowing? You open your bowels without controlling? And did you ever have any of these symptoms and they came with severe acute lower back pain? If the answer was yes, then that's something that's a red flag. It's urgent. You need to go straight to A&E. If you saw your family doctor, most likely he will or she will refer you straight to A&E. An MRI needs to be done, and a neurosurgeon needs to take over your care. So why your doctor will ask you these questions with somebody low back pain? If you imagine this is somebody sitting here, and then you have like all of the bones, the small bones of the back, which we call them the spine. Inside of the spine, you have like nerves, you have like the fluid which goes in, the cerebrospinal fluid, okay? And then you have all of the nerves goes in. So the lower part of the spine here, you have this called cod equina, okay? What happens? You know the bones, where like the bones of the back, where like the nerves run through. What happened? That sometimes these bones compress on the nerves. So if there was like any compression on the nerves here of the lower back, that can come with lower back pain and can come with all of these problems, with problem with the sensation of your legs or around the back passage. Okay, so why is it urgent? Because if the compression increases, that can cause paralysis. That can cause like sudden maybe cut in the nerves here of the back, and you might even lose the sensation completely, and you cannot feel your legs. So that's an emergency. Okay. I don't want to frighten you regarding like the causes which I told you here. These are the red flags. These are rare. These are not the common causes of lower back pain. But again, your doctor needs to ask you, and you need to know about them. Just if you know if it happens to you, if it happens to one of your family or your loved ones, you need to act on it straight away. Okay. So now we're going to go to the most common causes of lower back pain. As we know, sciatic nerve. Might came across that you saw one of your relatives, or maybe if you're listening, maybe you suffer from this problem. So what is a sciatic nerve? How does it come with? How does it present? It comes with lower back pain, and usually it shoots to one of the sides of your legs, whether it was right or left, and it comes as an electric shock. Okay, so how does your doctor notice that? When you see your doctor, he will ask you to lay down flat and raise the affected leg, raise it straight. If the symptoms increased, most likely you have sciatic nerve, especially if it was like an electric shock. Why? Because it's like a nerve pain. Okay, if you're listening at home and you think that, I could have like sciatic nerve, you can just do it by yourself. You don't need to even of course you have to go to your doctor, but before even going to your doctor, you can do it by yourself. You can just lay down and raise the affected leg and see if the symptoms increase. Raise it by 70 degrees, okay? So just explaining in a simple way why sciatic nerve happen. So we explained earlier about like the spine here, which is basically you have like some small bones. These small bones called vertebra, and then you have nerves which goes inside, and then these nerves, as you can see here, it branches, and when it branches, goes down to the lower limb, to the leg. Okay, so one of these branches is called sciatic nerve. So what happens here? The sciatic nerve, which branches from the nerves, which goes in the spine and goes through the pelvis, it might get irritated or inflamed. Okay, and that's why it causes this sciatic nerve problem. It's called sciatica. Okay, we know that lower back pain, it can affect a person socially, mentally, everything. It can cause even depression and stress. It can affect the work. So imagine if somebody has lower back pain and they work, for example, as a cleaner, or they're sitting all of the time on the office, or if they're a surgeon, they have to stand maybe for 5 hours in a surgery. It can even affect it can affect the whole life. If it was a woman, she might tell you, well, I cannot like cook anymore, I can't look after my kids, I can't do shopping. So sometimes people like who suffer from low back pain, they can go into a vicious cycle of having like this problem, and then maybe even like, as I said, it can affect them socially. It can cause like low mood and stress, and that can increase the pain more. How does that happen? Because when somebody has low mood, they lose motivation and interest in life, and then they cannot do exercise, they cannot like look after themselves. If they might overeat, because as we know, overeating is one of the symptoms of depression, and then they put, for example, more weight, and then they might suffer from more lower back pain, and etc. Go on. People with lower back pain, sometimes, especially if they have like an ongoing lower back pain, if they don't have like a supportive partner, again, that can be like an issue and a struggle on a daily basis. If it was a single mom with lower back pain, she has to do everything on her own, and she starts like demanding on drugs and painkillers. That's not very good quality of life, to be honest. It can really affect people. And if you're a doctor and you're listening, you need to ask about like all of the social questions and work for the patient. Examination. So what your doctor will do, he will check your temperature, make sure there's no infection going on. He will examine your back, check your spine, check on each bone of the spine, make sure there's no like severe pain, there's no like fracture or anything in the spine, and then also like examine all of the muscles of your back, make sure there's no spasm, because even spasm of the muscles of the back can cause pain, not necessarily like in the bone, not necessarily in your spine. And then your doctor also like will do the test for the sciatic nerve, and of course they need to do a full examination of the nerves of your legs to make sure that you don't have that condition, you know, the one which I told you earlier, the codoquina one, where the nerves of the back gets compressed with the spine. Compressed, with the bones around them, the codoquina one. Okay, so what is the treatment? Treatment will be depending on the diagnosis. So, for example, if your doctor thinks, well, you have a nerve compression symptom, so as we said, that's an emergency. It needs to go straight A&E, MRI, and then the spinal surgeons, they will look after you. They will take over your care. If there was a red flag, for example, if you had like a weight loss with low back pain, again, your doctor will need to exclude cancer, needs to do the 2-week referral. If you're in the UK, if you're outside of UK, then again, your doctor needs to exclude that by doing a CT scan and doing all of the investigations for whether it was prostate, whether it was colon, whether it was like if it was a woman, uterine, other things. If there was any sign of infection with low back pain, that means it needs an admission if your doctor thinks, well, the infection could be from the spine itself. or if your doctor thinks that, well, it could be maybe a water infection, then he needs to treat you for that. If your doctor thinks, well, there could be a fracture of the spine, that needs admission. So all of these causes, actually, they need acting very quick. If it was a sciatic nerve, some patients, I saw some patients who get like really frustrated with sciatic nerve. So first of all, you need to reassure them, tell them that it is an inflammation, irritation of the sciatic nerve. It should improve within 6 to 8 weeks. Physiotherapy can help if it doesn't improve by itself. Sometimes we can use like some generic painkillers, or even like we can use even painkillers specific for nerves. So there are two types of painkillers. You have generic painkillers, and then also you have specific ones. Okay, musculoskeletal pain. This is the most common cause of lower back pain. To be honest, like the causes which I explained earlier, they are not very common. This is the most common one. And it's usually like it will be like a bit of trauma which happened to the muscles of the back. Maybe a bit of spasm if somebody, for example, did some push-ups or lift something heavy, or maybe like slept in a wrong position. Sometimes they have like a bit of like aching and in the muscles or in the bones of the back. So reassurance, that's the most important thing. Bed rest. If it doesn't improve, let's say in 3 weeks, then you might think about physiotherapy sessions. Generic painkillers can help. I'm going to explain about the painkiller ladder in a moment. What else? Mild exercise can help. And if somebody, of course, suffers from obesity, losing weight definitely will help with lower back pain. So this is the ladder which we usually follow. So the ladder, basically, it means like you start with simple painkillers, and then the ones which are a bit stronger, and then more stronger. What are the simple painkillers? You have paracetamol, non-steroidal anti-inflammatories such as ibuprofen, naproxen, and then the ones stronger a bit, which are, these are opioids actually. Yeah, they're classified as strong, but not as strong as morphine. So you have like these ones are tramadol, codeine, and then you have morphine, which are the really strong ones. So it's very wrong that somebody goes straight away, they want tramadol and codeine, because that can cause addiction. And scientifically, studies shown that if somebody with lower back pain who get used to codeine and tramadol, after a while, actually, it doesn't work, because it makes your body become more sensitive to pain. So, and that's very known. It's very, very one of the common side effects of opioids, whether it was codeine, tramadol, or morphine, that long-term use of these opioids, your nerve receptors, basically like the nerves in all of your body, they become sensitive even for mild pain. So, and from what I saw, like the patients like who are on chronic opioids, sometimes even examining them, they start like shouting because of pain. It's just like it's because they're used to like having like codeine and tramadol. And remember earlier when I said like socially how and mentally how lower back pain, how it can affect people, how it can cause depression. So imagine if somebody has a chronic lower back pain because, for example, they don't do exercise, they have problem of obesity, or they keep on having like lower back pain. So they might end up being depressed because they feel like the quality of life is not very good, and because of that, they want something very, very quick and very easy. Like, for example, tramadol. It's a strong painkiller. Again, it's addictive. We know that tramadol and codeine are opioids. Opioids can cause euphoria. Euphoria, it makes you happy, like over the clouds. It can lift the mood. So that's why that's one of the struggles which the doctors have. They always get like patients with low back pain who want tramadol and codeine, and sometimes even they get addicted. They want morphine, and to be honest, these are like what we call them the angry patients sometimes, because their agenda is to take like opioids. But actually, sometimes it's just explaining to them that like on the long term, it will not really affect you. It's not that I don't want to give you medication. or it's not that the doctor doesn't want to give you the medication. The problem that if you take codeine and tramadol on a long term, you will become more sensitive to pain. It will not work. You'll become addicted. Codeine and tramadol will not help. You have to go like on morphine, and then morphine, and after that you'll go on a stronger, even stronger painkillers. And it's just like it will go into a vicious cycle. And the problem that when people get addicted, they suffer from depression if they don't get that drug. It's just a bad state where, like as a doctor, you don't wish any of your patients that go into that route. To be honest, if they can treat the reason behind the lower back pain, whether it was weight or whether it was nerves or whether it was any of the causes which I explained. Hopefully I explained it in a simple way. Okay, so these are the generic painkillers, which this is the ladder of the generic painkillers. Of course, there's other painkillers, but I'm just saying like just in a simple way. And these are the most famous painkillers, which most people know it. And then you have painkillers specific for nerves, like if somebody has like a nerve pain, like sciatic nerve, then you have amitriptyline, gabapentin, duloxetine, all of these. Okay, so we're almost finished. So I'm just gonna speak briefly about osteoarthritis. What is osteoarthritis? There are different definitions. There's definitions of wear and tear of the bones and the joints. It is natural because of aging. Some people have it like, as I said, some families they have it comes a bit earlier. Some other families it comes like later. It differs from a person to a person. So that's a definition. There's another definition which is more accurate, which is it is a flare and repair of your joints and your bones, which is secondary to age. Especially if it was like if somebody has like osteoarthritis of the spine, it's a bit of like, as I said, like wear and tear, or sometimes even some doctors they like to describe it as crumbling of the spine. Again, that can cause a lot of frustration for patients because they want a treatment for it, but the problem that if it was secondary, if it was a wear and tear because of age, there's no really treatment for it, unfortunately. It's sometimes like the doctors struggle like with expectations of the patient, so it's not easy like accepting that with age sometimes the joints and the bones they don't function the same as if somebody's in their 20s. So as I said, there's no treatment, unfortunately. There will only be like symptom control. And when I say symptom control, which is painkillers, physio, if somebody has like obesity on top of osteoarthritis, of course that will make it worse. So losing weight definitely will help. Exercise, staying fit. In severe cases, if somebody has like severe osteoarthritis, like then in that case, sometimes a referral to a surgeon, like if it was like in the spine, then referral to a spinal surgeon, or if it was like elsewhere, for example, like in other places, like in the knee, or like maybe osteoarthritis in the hip, if it was severe, again, like a referral to a surgeon. And the surgeons, they're not interested in anything. They will only be interested if the case, if it was severe, and they only will be interested if they're gonna open and do an open surgery. Basically, if they're gonna do an operation, then they want to see the patient. So that's why I said like if the osteoarthritis, if it was severe, but if it was mild, most likely the surgeon will not do anything. So a lot of patients with mild osteoarthritis, sometimes they come to the doctors, they want a referral to a surgeon. I tell them, why do you want a surgeon? You have mild osteoarthritis secondary to age. The surgeon will not do a surgery on you because the surgery has complications. Most likely, if, for example, if you have a joint or anything, they're going to do a surgery which has like different complications. Hopefully I explained about the most common cases. So just to summarize, as I said, like it's a long video. So we spoke about the common causes, which are musculoskeletal pain, muscle spasm. It could be maybe trauma. It could be a bit of like sciatic nerve, maybe nerve, as I said, like inflammation. The sciatic nerve gets inflamed or irritated. It could be wear and tear. The most serious ones, which are nerve compression maybe of the spine, by nerve compression by the bones in the spine, or it could be maybe cancer if there was an infection or if there was a fracture. Okay, thank you very much. And if you have any questions, please just write them in the comment section. Sorry. Thank you. Bye.